Hello guys, I hope all of you are fine. I'm Dr. Nita, PEDIATRIcs, and today the topic that we'll discuss that is autistic spectrum disorder. So first of all, just have a look at this video. See the baby. These are actually three children of the same family. Just kindly note the repetitive movements and the not a bit normal behavior. So, what is autism actually? Autism spectrum disorder, ASD or autism, that is a neurological and a developmental disorder that affects how people interact with others, communicate, learn, and behave. Although autism can be diagnosed at any age, it is described as a developmental disorder. Why? Because the symptoms generally appear in the first 2 years of life. Various words are used for autism like autism, ASD, ASC, all can be used for autism. The autistic spectrum disorder is characterized by persistent deficits in the ability to initiate and to sustain reciprocal social interaction and social communication, and by a range of restricted, repetitive, and inflexible patterns of behavior, interests, or activities that are clearly atypical or excessive for the individual age and social cultural context, as shown in the video. Or some sensory differences may also be a presenting feature. For example, some are disturbed by different brightness levels or wall colors or anything. Now, ASD may occur in association with any level of general intellectual or learning ability, and the presentation that ranges from subtle problems of understanding and impaired social function to severe disabilities. Impairments in each of the areas relative to the ESD occur along a continuum from minimal to severe. The Good Doctor, one of my favorite shows in which Dr. Sean Murphy, that's a surgical resident basically, and initially no one is willing to take him in this hospital because of his autism, and he faced a lot of skepticism. But later on, the way he uses skills, the way he treats his patients, the way he visualizes things and everything, that makes everyone believe that he's the good doctor. Not only a good doctor, but one of the best assets for the hospital. So I would really suggest the the show, because it's really good and helps us understand people with autism. Now, the onset of this disorder that occurs during the developmental period, typically in the early childhood, but symptoms that may not become fully manifested until later when the social demands exceed limited capacities. As long as the children at their homes, they are surrounded by their favorite people, by their parents, by their siblings, by their loved ones, symptoms are not that evident, but as soon as they are exposed to the outer world, they have to face different things, they have to deal with different matters, and that is a time that the demands exceed their capabilities, their abilities, and the symptoms slowly and gradually start to appear. Now, classification of ASD. There are basically two diagnostic classification systems in the current use, that are ICD-11 and DSM-5. ICD-11 that was published in, I think, in 2018, and DSM-5 was published in 2013. But with regard to the characteristics of autism, both ICD-11 and DSM-5 include same two categories. First one, that is different difficulties in interaction and social communication, and the second one is restricted interest and repetitive behavior, as I have shown it to you in the video. Now, what is the cause of ASD? Now, ASD is actually not a single disorder. It's a multifactorial disorder and has genetic causes as well as non-genetic factors and the interaction. Now, what are the genetic factors? There are too many genetic factors, but a few of them that are listed are: the first one is the genetic causes include gene defects and chromosomal anomalies have been found in 10 to 20% of individuals with ESD. Sibling bonds in families with ESD subject have 50 times greater risk of ESD with a recurrence rate of 5 to 8%. Genome-wide linkage studies suggest linkages on chromosome 2q, 7q, 15q, and 16p as the location of the susceptibility genes. Metabolic errors including phenylketonuria, creatine deficiency syndrome, adenylosuccinate deficiency, and metabolic purine disorders account for fewer than 5% of individuals with ESD. What are the different environmental factors? So the three main factors are the prenatal factors, the perinatal, and the postnatal. Now, what are the prenatal factors? Prenatal factors include advanced parental age, or exposure to the teratogens. For example, if the mother used thalidomide, if she used some anticonvulsants such as valproic acid, organophosphates, or maternal diabetes, and some certain infection, for example, congenital rubella syndrome, influenza, cytomegalovirus. Perinatal factors include the low birth weight, the short gestational length, the birth asphyxia, the postnatal factors include autoimmune disease, viral infection, hypoxia, mercury toxicity. Now, what are the risk factors? There are a lot of risk factors associated with autism, like a sibling with autism, birth defects associated with CNS malformation and dysfunction, gestational age less than 35 weeks, parental schizophrenia like psychosis or affective disorder, maternal use of sodium valproate in pregnancy, a learning disability, attention deficit hyperactivity disorder, neonatal NCAF or epileptic NCAF, including infantile spasm, chromosomal disorder like Down syndrome. You can see many Down syndrome babies with autism, genetic disorders such as fragile X, muscular dystrophy, neurofibromatosis, and tuberous sclerosis. Now, how will babies with autism or the children with autism present? So now symptoms in the core domains of ASD usually emerge between the 12 and the 24 months, and initial presentations are vary, and there's no one behavioral sign that rules an ASD diagnosis in or out. But what will be the initial concentration of parents? That may include language delay. They may come with you with the complaint of that the baby isn't talking, and there is a language delay. And when I call the baby, he doesn't respond to me. There'll be a lack of response when the child name is said. There'll be limited eye contact. So, but the presentation according to different ages that can be summarized. Like, for example, in preschool children, that can be categorized as spoken language, responding to others, interaction, and other gestures. In spoken language, there will be a language delay, there will be regression of speech, use of single words instead of sentences. For example, I know someone, and there was a matter going on, and there was a matter going on, but when they heard the baby speaking a whole sentence, they were so surprised that, oh, finally, thank God, now the baby spoke in a whole sentence for the first time at the age of 5. Frequent repetition, reference to self by name. The second one, that is responding to others, absent or delayed response to name being called, reduce or absent responsive social smiling, reduce or absent responsiveness to other people's facial expression of feeling, unusually negative response to the request of others, rejection of cuddles initiated by parents or carer, and the interaction include reduced or absent limitation of other actions, reduced or absent in initiation of social play, with others, plays alone, reduce your absent sharing of enjoyment, reduce your absent enjoyment of situations that most children like, and in other children's, reduce your absent use of gestures and facial expressions to communicate, reduce your absent social use of eye contact, assuming adequate vision, unusual restricted interest or rigid repetitive behaviors, over focused on unusual interest, excessive reaction to taste, smell, texture, and appearance of food. In children of age 5 to 11 years, spoken language will be limited use. There will be a monotonous tone, talking at others rather than sharing a two-way conversation. Responding to others can seem rude or inappropriate. In responding to others, there will be reduced or absent response to other people's facial expression, reduced or delayed response to their name being called, subtle difficulties in understanding other intentions, may take things literally and misunderstand sarcasm or metaphor. Now, for example, in the season, and the good doctor, initially he doesn't understand any sarcasm. Then he makes a list of all the metaphors and all the sarcastic lines, and then he relates them to everything, and then he slowly and gradually start understanding the sarcasm or metaphors. Interaction, they have reduced or absent greeting and favorable behaviors, reduced or absent awareness of socially expected behavior, reduced or absent ability to share in social play or ideas of others, reduced or absent enjoyment of situations that most children like. And in other gestures, they make comments without awareness of social niceties, excessive insistence on following own agenda, extremes of emotional reactivity that are excessive for the circumstances, dislike of change. In adults, one or more of the following: persistent difficulties in social interaction, persistent difficulties in social communication, stereotypical behavior, resistance to change, or restricted interest, and one or more of the following: problems in obtaining or sustaining employment or education, difficulties in initiating or sustaining social relationships, previous or current contact with mental health or learning disability service, a history of a new developmental condition including learning disability, and ADHD or any mental disorder. Now, what are the screening tools? ASD specific assessment tools may be used to supplement the process of clinical history taking. For example, checklist for autism in toddlers, chat for children between 18 to 24 months, the autism diagnostic interview revised ADIR, the diagnostic interview for social and communication disorders, DISCO, and the developmental dimensional and the diagnostic interview. Now, a negative result does not essentially means that there is no ASD. If a parental concern continues, a referral is advisable. Now, the assessment of the children and young people with developmental delay, emotional and behavioral problems, psychiatric disorders, impaired mental health or genetic syndromes should include surveillance for ASD as a part of routine practice. A baby with autism, playing all alone, away from all the world. Differential diagnosis can include neurodevelopmental disorder, for example, any specific language delay or disorder, learning, intellectual disability, or a global developmental delay. Now, mental health and behavioral disorder, for example, ADHD, mood disorder, anxiety disorder, attachment disorder, conduct disorder, obsessive compulsive disorder, schizophrenia, conditions with developmental regression, for example, Rett syndrome, epileptic encephalopathy, childhood disintegrative disorder, that's also called Hiller's disease. Maybe an example: severe hearing impairment and severe visual impairment. Now, what will be the management? In management, how will you manage a baby if someone comes to you that a baby has autism, or they complain of everything that was mentioned in the presentation topic, presentation section? What will you do? The first one, give them some flashcards, give them, that include words, pictures, symbols that are meaningful for the child or the young children. Make reasonable adjustments or adaptations to amount of personal space given, considering individual sensory sensitivity to light, noise level, and color of the walls and furnishings arranged to support autistic children and young people and their family and carers during times increasingly that includes major life changes like puberty, starting or changing the school, or birth of a sibling. There are various interventions like behavior and their psychological intervention, intervention for the behavior, the challenges, communication intervention, occupational therapy, intervention for sleep problems, intervention for feeding problems. Now, behavioral and other psychological interventions, intensive behavioral and developmental programs aim to improve overall functioning with specific behavioral difficulties associated with ASD, such as sleep disturbance, increased positive behavior such as adaptive skills, and initiating social contact with the peers. Early intensive behavioral intervention programs aim to engage the child with ASD in a structured learning program that is highly individualized, taking into account the idiosyncratic motivations and specific needs of each child. Now, communication interventions. What is communication interventions? So that includes the speech and the language therapy that is the most effective, when the speech and the language therapists also train and work with the teachers, the families, the peers, promoting functional communication in normal environment. Occupational therapy also includes sensory integration therapy, has been used when there are marked sensory perception issues, for example, oversensitivity to touch. So basically, what do? They desensitize the child gently over time. Occupational therapy also focus on development and maintenance of fine motor and adaptive skills, and they can also provide advice and support in adapting environments, activities, and routines in the daily life. Now, what will be the interventions for life skills? Offer support in developing coping strategies and assessing the community services, including developing skills to assess public transport, employment, and leisure facilities. Now, what will you do if there are some sleep problems with the baby? So first of all, offer an assessment that identifies the nature of the sleep problem and any underlying factors such as day and night sleep patterns, any change to those patterns, whether the bedtime is regular or not, and whether the sleep environment is like. Consider the possibility of obstructive sleep apnea too. Now, what you will do? Develop a sleep plan for the baby. Ask the parents or the carers to record the child or young person's sleep and wakefulness throughout the day and the night over 2 week period. And if there is any pharmacological intervention needed, so if there is anything needed, so you can consider melatonin and only use it following consultation with a specialist pediatrician. For feeding problems, any restricted diets can result in nutritional deficiency that may have serious consequences. Assess for any feeding growth of nutritional problem, monitor and refer if needed. It is too necessary. Pharmacological and dietary interventions. The management of ASD is essentially non-pharmacological. However, certain drugs may be considered for the management of the coexisting psychiatric and neurodevelopmental conditions and may occasionally have a short-term role in alleviating the core symptoms. Do not use the antipsychotics, the antidepressants, or anything without any pediatrician consult. What's the prognosis? Now, ASD is a lifelong disorder and has a great impact on the child or the young person and the family or the carers, and they vary greatly in terms of level of impairment, which influence the prognosis. A minority of affected people with lower level impairment live and work independently in adulthood. However, there is evidence that adult outcomes are poor, and adult developmental milestones such as work or intimate relationship or independence from parents are often not achieved. The presence or absence of associated intellectual disability, language impairment, and additional mental health problems are the most important prognostic factors. Unaffected language development and the absence of an associated intellectual disability are associated with a more favorable prognosis. Now, the prognosis of ASD can be improved by early diagnosis and assessment with the provision of support and services in education, health services, social care, and voluntary organizations, and contact with other family members. Thank you. This was all about autism. I hope you enjoyed it and I hope you learned